was done in Serbia on 2016. They just investigate about NBD primiparous women, and the findings showed that NBD is not a risk factor for PTSD, and the obstetrical complications as an unplanned change significantly increase the likelihood of PTSD. But this article supported our findings regarding to the reason of preferring less NBD in Iran, not because of the nature of NBD, but because of the unskillful midwifery students in charity hospitals, especially that lead to obstetrical complications. So according to the environmental differences, different desire can be the reason. And the results in our study shows the incidence of PTSD in women with NVD was higher than C-section. And this is the first research to find such results. So it could be clarified by the explanation that I open it up. So due to the fact that pregnant women referring to charitable hospital affiliated to this special university were examined in our study, and these hospitals are also considered teaching hospital. So basically NVD is performed by midwifery students, and they are not gynecologists. So pregnant women had worried and felt insecure in the absence of gynecologist, while in cesarean section, the mother is assured that during the whole process, gynecologist is present. So most of C-section in our study were uncomplicated, normal across from side to side horizontal incision that extended across the pubic hairline. And it's used most often because it heals well and there is less bleeding. So in the society that this study was done, and in general in third world countries, due to the fact that C-section should be performed completely elective and voluntarily at the request of pregnant women, in addition to emergencies, many pregnant women ask their gynecologist to do so. Some of the reason of choosing elective C-section are like women who had a history of traumatic NVD or have friends and family which had such bad experience. They are afraid of similar accidents during NVD, so they choose to have C-section instead of NVD. And some of these traumatic events like vaginal bleeding, prolonged labor, PROM, failure to progress, fetal distress, and suction and asphyxia of the infant can be the reason for asking to have C-section, or the episiotomy, fear of long-lasting labor and the pain with insufficient effacement and failure in progress. So all of these unpleasant and disgusting feeling that the pregnant woman endure in repeatedly vaginal examination, which are necessary to assess labor progression also in NVD. So all of these together leads to increased desire of women to have C-section more than NVD. And as you can see in this figure, the nervous system which is affected during delivery and also during the third trimester of pregnancy is segmental T10 to L1, which is affected, and lumbar sympathetic system and sacral system, and also all together with the nervous system around amniotic sac. So all of these are affected. So the pain that is suffering is more. And one of the possible reasons for this is the lack of knowledge of women about new methods of painless NVD in a third world country, which will decrease the occurrence of anxiety before and during childbirth, and excessive publicity about C-section, which affects mother's attitude and can be another factor. So the perception of labor pain can affect the desire and preference of the type of labor, and increase the negative perception about the pain of normal labor, significantly reduce the tendency to normal labor. So by improved midwifery students' skill to prevent complication during NVD, we can reduce the amount of elective C-section, and educating pregnant women can also reduce level of fear and anxiety. And however, today's C-section is perceived as a escape from labor pain, and the false assumption that C-section is painless, safer, or healthier than vaginal delivery has become prevalent among women. But in fact, more than half of the women voluntarily choose C-section as a preferred mode of delivery. So as a conclusion in this study, the frequency of PTSD was higher in women with NVD than in the C-section group. And this is a health problem that needs attention to reduce the risk of trauma in NVD, and offering more pain-free methods of NVD and psychiatric consulting, and teaching mothers about the benefit of NVD to decrease elective C-section level. And all those considerations may reduce the risk of PTSD in these individuals. Thank you so much, everybody, for your attention.